We are seeing an increasing trend of infertility. There are rising number of cases in today's world, and one of the difference that we are noticing, which is leading to increasing number of infertile couples, is because of the lifestyle. The lifestyle where we are having people who are having a very sedentary life. We are so absorbed in our work that we don't have any time to give to our bodies for our maintenance, or for that matter, we don't have any physical activity that we are indulging in. So that ultimately takes a toll on our health, and infertility is a byproduct of that side effect. So what is happening is that we have patients, young patients now, our national body mass index is going on increasing. People are becoming obese at a very young age, and they're all blaming it on their hectic lifestyle, hectic schedules. They don't have any time for controlling, having a mindful diet or exercising. So because of this, we have young couples, young ladies who are suffering with PCOS, which is because of their lifestyle, which is mainly a side effect of their lifestyle. And we also have men who are very obese. Ultimately, even for men, when they tend to put on a lot of weight because of sedentary lifestyle, it tends to affect their hormonal balance. The male hormone to female hormone ratio is disturbed, and that ultimately affects the sperm production. So these are some of the common things. Besides this, stress plays a major factor. Though we can't say definitely that stress is affecting at this level, that it's affecting this part of the physiology. But yes, we are seeing that because of the stressful lifestyle, couples are not spending too much time together. So if you don't have time for each other, obviously it's going to affect your fertility somewhere. So that's a very practical problem which a lot of couples are facing. Stress is also leading to a lot of sexual dysfunction in the males, and that's something which we are trying to target through our AndroLife clinics. We want couples, we want the husband especially to come forth, not to be very hesitant to come forward and ask for help if they are suffering from any such problem. So infertility in the villages, it's a lot about the chemicals which are present in the environment also. So there's a lot of research which is being done on this lately. So this is a totally different topic altogether. But yes, the times in which we are living, the kind of processed foods, the packaged food, and even for that the chemicals, the pesticides, all that we are being exposed to, that is somewhere affecting later the fertility down the hill. And for villages, it's more about the ignorance. Okay, it was there, infertility was there. We don't know how it was being treated. Now we are like having people through all these programs which we are conducting. We finally have them coming out and seeking help. So we know that infertility is not exclusively a problem of the urban population. It is there somewhere in the villages also. In the ladies, especially in the villages and all, where they have not been receiving timely treatment, you have problems like tuberculosis or you have tubal blockage. So these are things which they were unaware of and not taking treatment for earlier. Now they're coming forth, and we know that these are like very prevalent problems, and of course we have some options available for them. Highest, if a couple gets pregnant, it's 100%. Right. So highest though is 100% that the patient got pregnant. It's always an average that you treat so many couples. So as far as research in infertility is concerned, there's a lot of upcoming research. We are still trying to understand the way the human body works, and there is a lot that we have decoded. There is a lot which is still a mystery. So that's the reason why we are not, despite our best efforts, we are not able to claim that you have 100% success rate. But yes, we have been able to identify the genes which are involved in implantation. We are able to identify the factors which might be like DNA fragmentation index, which if it's raised, it will reduce the male chances of conceiving. So there are a lot of factors which we have come across and which we are investigating couples for. Now, what is the R&D which is being done in order to reduce the cost? Earlier, these tests which were conducted, they were mainly being outsourced. So they were being sent to countries like Spain and UK for the investigations to be done. So it was very expensive. Now there are a lot of homegrown companies which are in India which are actually offering the same test at a better rate. But of course we have to maintain the quality also. So we are starting to find out whether they are giving the same results. But yes, we have options. Of course, we're going to offer them once we are convinced that the quality is the same. But yes, they are coming up with it, and we are very happy about it. So regularly, a very common factor, very common problem. Okay, PCOS, now there is a bit of awareness of the fact that PCOS is related to lifestyle. So people are becoming conscious that, we should exercise, we should maintain a certain body size and type. So that is important. But a very common factor which I'm seeing is a problem of diminishing ovarian reserve. Patients, ladies, their eggs are getting over very soon. they're depleting very fast. So that's something called as premature ovarian insufficiency. A milder part of it is something called as diminished ovarian reserve. So these patients, the kind of eggs, the number of eggs which you would normally see in a lady who is about 40 years old is what we are observing in 20s and 30s. And so for these patients, it becomes important that you give them a treatment which gives them highest success rate as soon as possible, while they still have eggs. So that's the patients who benefit most from IVF, from fertility preservation.